Welcome to Ageless and Outrageous, your favorite podcast about how to age amazingly. I'm urogynecologist and hormone and sexual health expert, Dr. Kristen Jackson. Every week, my incredible and knowledgeable nurse practitioner, Rosalind Arp, and I share our combined 30 years experience to guide both men and women as they age. Listen as we dive into a variety of topics, including hormone optimization, pelvic floor health, maintaining a vibrant sex life, weight gain issues, and skin, hair, and body changes as we age. These real-life insights are always rooted in solid scientific knowledge. Tune in for a dose of laughter, knowledge, and an honest perspective on the incredible adventure of growing older. Welcome back to the podcast. Today, we are talking about really what is my favorite hormone to optimize in both men and women, and that's testosterone. So testosterone gets a bad rap sometimes. There's a lot of mythology around it. There's a lot of unfounded facts that get put out there, either in conversation or on the internet. So we are here to talk about the top 3 myths that keep getting perpetuated about the use of testosterone in women. So, Rosalind, what types of symptoms do patients tell you they have that make you think that they might benefit from optimizing their testosterone?
The classic one is low libido and difficulty having orgasms or reaching orgasms like before, and also brain fog and fatigue. Those are the typical symptoms mostly, and also building muscle mass is another one.
Okay, great. So let's jump into our first myth that is out there, which is that testosterone is only an important hormone for men. Testosterone is one of the most important hormones for human beings in general, both men and women. We both make testosterone both before and after menopause or before and after menopause, if men go through their own version of it. And for women, testosterone is the most abundant sex steroid throughout our entire life. The level of testosterone in women is actually higher than the level of estrogen in women at any given time.
Yeah. So testosterone is actually measured in nanograms per deciliter, which is 10 times higher than picograms per milliliters, which is how estrogen is measured in your bloodstream. So when you look at the number at the lab, the testosterone can say 20 and estrogen can say 100, but technically the testosterone will be more abundant.
That's right, because the nanograms are actually 1,000 times higher than the picograms that we use to measure the estrogen. So if you're looking at a lab value that you've had drawn, you've had your hormones done, you have to know that you're just not comparing apples to apples with testosterone and estrogen because they're measured in different units there. And then we also have with estrogen, there are actually 3 types of estrogen that circulate in our bloodstream. With testosterone, there's only testosterone, but there are other androgens, which are testosterone-like hormones that circulate. Those are hormones like DHEA and DHEAS, as well as androstenedione. They actually come from our adrenal gland, which is a little gland that sits on the top of our kidney, and they all help to contribute to the androgen status in our body. Now, typically for women, their testosterone will peak in their 20s and early 30s, and then it may sort of be steady for a while. But really, about in the 40s, women's testosterone starts to slowly decline. And that's just because the ovary and the adrenal gland just slowly start making less of it as we age. So when women start to lose testosterone, it's not an abrupt drop in menopause, which is kind of what happens with estrogen. It's a slow and steady decline that often starts in the 40s and then just continues. Men also have a slow and steady decline in their testosterone, but they tend to hold on to it a little longer. They usually start their decline maybe in their 50s and then continue on. So when we look at loss of testosterone symptoms, a lot of the symptoms that we just think of as normal aging might actually be related to the fact that we're just slowly not producing all the testosterone we used to make when we were in our 20s and 30s.
A lot of the times women will blame their career or, their marriage in terms of like they've been married for a long time, or, their kids, like that's why they don't have any more libido or they're more tired lately. But I always tell them, look back in your 20s, you remember you could study all night long and take a test the next day and have a lot more energy the rest of the time, and your libido was really high. That's because your testosterone was optimized at that time. And now as you age, that also has declined So the other myth that we have in terms of testosterone is that it only plays a role in libido or women's interest in sex. But testosterone also has a role in many parts of our body. We have a lot of testosterone receptors in our breast, heart, vessels, bladder, uterus, ovaries, vaginal tissue, skin, bone, you name it, pretty much most tissues in our body.
Right. And if you remember that a hormone can only do its job by floating through the bloodstream and interacting with its receptor. So wherever the receptors are for a hormone, that's where the hormone is going to have an effect. So the fact that there are testosterone receptors almost head to toe lets you know how important testosterone is. That means it is going to have a positive effect on our brain, on our heart and vascular system, on our bones and muscles, certainly on our reproductive organs. There almost are no organs that don't have testosterone receptors and aren't going to have a positive effect by optimal testosterone levels.
So for women, there are a lot of testosterone receptors in their vulva and their clitoris. So that's where that libido is involved in. It affects orgasms in general. It affects sensitivity when you're having intercourse. So women need testosterone to have an orgasm. But the role of testosterone in women's libido comes in two parts, one in the vulva and the clitoral area and also in the brain. So, but in the vulva and the clitoris, there's a lot of receptors there for testosterone. It has the same germline anatomy as a male's penis. And so the vulva and the clitoris responds better when you have an elevated testosterone in your bloodstream or when it's optimized. So your orgasms and the sensitivity of the clitoris is much higher when you have optimal testosterone levels.
That's right. And there's even some medical conditions to the skin of the vulva and the opening of the vagina that respond to testosterone as a treatment. So as we age, that skin tends to get thinner, drier, and it can be exposed to some autoimmune diseases like lichen sclerosis or lichen planus. And some of the treatments for those are actually applying testosterone cream to that area. It really does help to plump up and thicken up the vaginal tissue, improve blood flow, as you said, and good blood flow to the clitoris and vagina is always good for sexual health. But testosterone works in the brain as well. So it's not just circulating locally at the level of the vagina, it's circulating in the brain. And it is a big factor for desire and libido. So it's really hard to be able to bring up that sexual desire if your testosterone levels are low. You can imagine, as we said, for women, if your testosterone levels start to decline in your 40s, by your 50s and 60s, they're essentially gone. And then women complain about, I love my husband, my relationship is wonderful, but if we never had sex again, I'd be fine with that. Who cares? That's not normal. That's a direct result of the fact that they have no testosterone around. So when they look at their loved one, they just can't get that part of their brain working that brings up the desire and arousal to even have sex. And when I talk to those patients, many of them say, well, if I do kind of say, all right, well, we'll have sex tonight because I feel bad for my husband, I end up enjoying it. Just getting over that hump of wanting to have sex is their big barrier, and testosterone can really help with that.
Yes, and there's other and yes, there is also other areas of the brain that the testosterone can help. It can decrease the inflammatory plaques that build up that can lead to dementia. So having optimal testosterone can decrease your risk of dementia as well.
Yes, testosterone is an amazing anti-inflammatory hormone really throughout the body. So as we age, those inflammatory plaques that build up in the brain are directly related to the development of dementia. But we also get plaques that develop in our blood vessels and around our heart. I think a lot of people are familiar with that, plaques in the arteries as we age. And eventually, if one of those plaques blocks an artery or ruptures completely, that's called a heart attack. Good optimization of testosterone over time helps to reduce that whole body inflammation and reduce specifically the inflammation in our blood vessels, which leads to protection against plaques in the arteries and heart attack. And for women, especially, I know women have, as we age, a lot of fear about breast cancer. That's kind of ever present in many women's minds, but heart attacks and heart disease is the number one killer of women over age 50. So we really should be most fearful about heart attack and stroke and other cardiovascular disease. And testosterone is a great way to reduce that risk.
Yes, and I actually mention that to my patients because I tell them when it comes to testosterone, both men and women decrease as they age, as we said earlier. But when you look at it, when women pass a certain age, it skyrockets on the amount of women that gets heart disease, dementia, and osteoporosis, which is another area that testosterone can help in. And those three are much higher in women than it is in men. And it's probably because men have, even though their testosterone has decreased, it's not as low as women.
That's right, because we see that before menopause, women often are protected by their hormone balance from things like heart disease and plaques in the arteries. So we see a lot of younger men with heart disease from other reasons. They may have good testosterone around, but they have other either genetics or unhealthy habits that lead them to heart disease. But women rapidly catch up as they go through menopause. And it really is related to that loss of testosterone and also the loss of estrogen as well, which we're not specifically focusing on today. So that after menopause, we really don't see that protection anymore unless women are protecting themselves with proper hormone replacement therapy. And you mentioned bones. Testosterone is fabulous for helping us to strengthen our bones.
Yes, because testosterone is a bone building hormone. Our bone is constantly remodeling and we're building bone and breaking down bone as we need to. And as we age, we lose bone more than we build bone. And testosterone can actually help increase building bone. So it can actually reverse osteopenia sometimes or osteoporosis.
That's right. So there's those two sets of cells in our bone. The osteoblasts are the bone builders. They build up new bone. And the osteoclasts are the bone breakers. They break down old and aged bone cells. And usually when we're younger, the level of those two cells are equal. So we build bone at the exact same rate at which we break down bone. But as we age, those bone builders work less and less and less. So we're not building bone as fast. But there are testosterone receptors on those osteoblasts, on those bone building cells. So they really stimulate those bone building cells to work better and to build up more healthy bone faster so that we're less likely to have a fracture.
And most medications for osteoporosis is more so to slow down the breaking down of the bone. So that's why I feel like testosterone has shown much more of an improvement in terms of their bone density.
That's right. Yeah. All those medications you may have heard of, like Fosamax, those are in a category called bisphosphonates. They work on slowing down the osteoclasts, which are the bone breakers. But testosterone is working on building up the bone growth. And I think we definitely need more study on it. Probably a lot of patients are aware that long-term use of bisphosphonates has actually been associated with necrosis in the jaw, which is an abnormal bone development. So bisphosphonates are not something that we just want to use endlessly for the rest of your life, because when they're slowing down that bone reabsorption, the new bone that's being built up is not as good as we want it to be. So I think testosterone could be an interesting way to build up proper healthy bone so we have less of a risk of that osteonecrosis that is associated with Fosamax and Boniva and other drugs like it.
But testosterone right now, it's not a first-line treatment for osteoporosis. Is that correct, Dr. Johnson?
That's right. It's not FDA approved. So technically that is considered an off-label use. But as I said, we know the receptors are there on the osteoblast. So we know that it is positively affecting bone growth. And just like it grows bones, testosterone also grows muscle. This is a huge area. We have a lot of people who are physically fit, very active. And one of their complaints as we get older is, I'm working out just the same as I was before, but I just can't build my muscle. You know, I'm lifting weights and I'm being aggressive. And where's the definition that I once used to get? And you absolutely need testosterone to build muscle. It's impossible to build more muscle cells without it. So maximizing your testosterone helps your workouts to be most effective so you can actually see the results with good muscle development.
Can you tell us more about that study you were mentioning to me before regarding testosterone and exercise?
Oh, so that was actually a study done in men, but it was really interesting. They took 3 groups of men. One group of men took testosterone supplements and also did weight-bearing exercises. The second group of men took testosterone supplements, but did no exercise at all. And the third group of men did weight-bearing exercises alone, but did not take any testosterone supplements. And they were studying to see which of these 3 groups of men would have the most muscle gains, the biggest growth of their muscle. And what they found, not surprisingly, is the men in the group who both took testosterone and did weight-bearing exercises had the most muscle gain. That was expected. But what was really interesting is what happened between the other two groups. The middle group, the men who took testosterone alone and did not exercise, had more muscle mass gain than the men who exercised and did not take testosterone. So these guys who were taking their testosterone supplements, but, sitting on the couch and watching the game or playing video games or doing nothing, being a couch potato, ended up with more healthy muscle mass than the guys at the gym not taking testosterone. That really points to the value in testosterone at being able to build muscle, even as a standalone intervention.
So for women, muscle mass is really important as well, because this helps us with our balance. It helps us with our gait. Muscle also helps us maintain our weight because it increases our basal metabolic rate. It's how much calories we burn, because it just takes much more calories to maintain a pound of muscle versus a pound of fat. So for women who complain about weight gain after menopause or after, as they age, testosterone is a part of that.
It's so true. I even see in my own family, my mother-in-law is a very healthy, slim woman. She has an appropriate weight. She's physically active. She generally looks great, and she's in her 70s. But she had a fall on one of her morning walks. She does go out and walk every day, and her toe caught in a crack in the sidewalk. And she was just all banged up, looking horrible from the fall. And it's those types of things, the unexpected trip when you're on your healthy morning walk, that can really set people back if they don't have healthy muscle to protect them and if they don't have strong bones to prevent getting a major fracture. So what we typically see as people age is they're generally doing great. They look good. They look healthy. Then they have an unexpected fall. And recovering in bed and laying in bed from that fall, they suddenly start getting a whole host of other complications, pneumonias, blood clots, more loss of muscle mass because they're not up and moving. And very often that seemingly innocuous fall is really what is the turn for the worse in terms of their health.
Yes, I used to work in rehab medicine for patients who've had falls, and as a nurse, and definitely it really is the start of the decline of their health for the most part.
And I think most people don't realize that it could happen to you. If you are generally an active and fit person, you feel like, hey, I'm not a little elderly person with a cane or a walker. Those are the people who are at risk for falling. But unfortunately, we all increase our fall risk as we age, but maintaining good muscle mass and maintaining good posture and ability to lift our legs as we walk and not drag our feet as we walk, all of those body mechanics relate to strong, healthy muscles and bones and prevent falling. So I think it's just always shocking when you think, I'm doing pretty well, overall with my health. And then you have a fall and you think, oh my gosh, it took me forever to recover from that fall. And maintaining good testosterone really helps to shorten that recovery time.
Since we do urogynecology as well, have you heard from patients regarding testosterone and the decreased symptoms of interstitial cystitis, or if someone doesn't know, it's inflammation of the bladder?
So we have many patients in our practice with interstitial cystitis, this painful bladder syndrome, constantly feeling like you need to urinate. It hurts to hold urine. And many of these same patients are also in our hormone optimization program. And it would make sense that a powerful anti-inflammatory hormone like testosterone is going to have positive effects for a bladder that is constantly inflamed. And even though we have no official medical data to support that, we have heard stories from our own patients who have interstitial cystitis and then subsequently go on hormone replacement, including testosterone, who've said, my bladder has never been better. And I think the most important thing about the anti-inflammatory effects of testosterone is they're not a quick turnaround. So very often when we treat patients with testosterone, right away, they feel improved energy, improved strength, a clearer brain, less brain fog, but improvements in things like muscles, bones, maybe their bladder, if that's going to come, that takes time, sometimes 2 years or more. So it really speaks to the fact about maintaining long-term good hormones has really important effects, but you just may not see those results right away.
Yeah, I had a patient who had a knee replacement prior to starting testosterone replacement therapy, and then had one, I believe, a year later on the other knee with while on testosterone replacement therapy. And he said that it was a big difference in terms of recovery. He felt like his recovery was much better and quicker on the second knee replacement than the first one. And he attributes it to the testosterone that he was taking.
I agree. I had another male patient who was using testosterone therapy, and he was in a car accident where he actually broke his back.
Oh, wow.
And his surgeon told him, this is going to be a long recovery. Just plan for it to be really sore and you're going to have to rehab. And he did his physical therapy in his rehab. And he said, I really feel like my testosterone supplements are what made me be able to recover so much quicker, because my surgeon had said, you're going to be down for the count for several months. And it really took him several weeks of therapy to get back up on his feet. And he's doing very well.
Oh, wow. That's great.
Yeah. So we hear these anecdotal stories, and we're always very cautious about, in medicine, we try to be data driven and make sure that we have studies that actually prove what things do and not just use anecdotal stories. But when we hear all of these positive things, we know that there's at least a good positive effect, even if we don't have the medical data to support every single claim. Thousands and thousands of patients are a good source of information as well.
Mhm.
So the final myth we're going to address today is that testosterone must not be safe for women because it's not FDA approved for use in women. And that's true. There are no pharmaceutical products that are officially FDA approved for use in women. This is really a huge gap in medical care because there are so many studies out there showing the benefit of testosterone in women, but there's a lot of challenges to getting it FDA approved. The first thing is that the road to FDA approval is pretty long and it's very expensive. That's usually why big drug companies, when they're bringing their drugs to market, they have the deep pockets to kind of do all the research and pay all the fees to get their drug approved by the FDA. But the FDA also says that you cannot get a patent on something that is naturally occurring. And so since testosterone is natural, no one can patent it and put testosterone in a product and call it their own. They didn't develop testosterone. It already exists. So the only way that they can get a patent on a drug would be to alter it in some way, ideally to make it better. But what we have learned over many years of hormone treatment is once you alter a hormone, it may have some of the positive effects, but we can also get side effects from altering that hormone. So those are some of the challenges to getting a testosterone product FDA approved.
But there are pharmaceutical or synthetic testosterone in the market right now for men. Is that correct?
There are actually 3 types of testosterone that are on the market, but they're only for male use. The one that we most commonly use is testosterone sapionate. It's an injectable form. Both men and women can get that as an injection, but again, only FDA approved for use in men. But as I said, I always am cautious about anything that is altered from its initial chemical state. We've learned that, especially with progesterone, when we alter progesterone, we get some positive effects, but unfortunately not all of the good effects. We try to use bioidentical hormones, which are chemically exactly the same as what come out of the ovary or testes, to get that exact same effect.
So when we're using testosterone sapionate for women, it's an off-label use for women. With bioidentical testosterone, that's not FDA approved at all, correct?
Right. So the use of bioidentical testosterone for women is also an off-label use. But it's important to recognize that off-label doesn't mean unsafe use. We use tons of medications that are FDA approved for one thing for a different indication for that off-label use. So birth control is a great example. Birth control is FDA approved to prevent pregnancy. But very often we use birth control to control women's acne, to reduce menstrual bleeding, to reduce pain and cramps with periods. Some of those things are off-label use. Now, of all the birth controls on the market, there's only one that actually has an FDA approval for reducing acne. That's one called Yaz. They actually specifically did the studies to prove that they could reduce acne. I will tell you that all oral birth control helps to control women's acne. But for all of the birth control except for Yaz, that's considered an off-label use. So I think it's important to recognize off-label doesn't automatically mean unsafe. So for bioidentical testosterone, there is a huge wealth of knowledge about the safety of its use in medicine. It's been used as a product since 1937. And some of the studies that we have show using very large doses in women as being safe, probably larger than the typical doses that we would use. There are several physicians who have just written paper after paper in this area that really speak to the safety of testosterone in women.
So I know testosterone is a category X in pregnancy just because I was one of the ones that were quite concerned about that. My libido went up when I took testosterone for the first time and got pregnant accidentally. Working in gynecology, that's quite a story, right? And I was quite concerned about having any changes to the fetus, especially if it was a girl. What do you think about that, Dr. Jackson?
Well, I know because I had to counsel you personally as we went through this, but the animal studies show that the level of testosterone that a woman would have to take in order to cause a negative effect are huge. You would have to take up to 50 to 500 times more than standard testosterone doses to have a negative effect. And as you mentioned, what would the negative effect be? It would be that if you're pregnant with a girl, she could have some difficulty developing as a female-looking fetus if there's too much testosterone around. The second protection that pregnant women get is that they have a placenta, and the placenta is filled with a hormone called aromatase. So all of the testosterone that might be circulating in a woman's bloodstream as it tries to pass through the placenta and get to the baby would first encounter this aromatase hormone and be changed or aromatized into estrogen. So a lot of that testosterone gets changed into estrogen as it passes into the fetus anyway. So category X means it's a never use. We would never knowingly give a pregnant woman testosterone. So if we knew you were pregnant, we would tell you to no longer continue your testosterone therapy. But even women who inadvertently get pregnant, as per you, or who maybe were using testosterone and were getting ready to start again and wanted to get pregnant, we can just tell them to stop and get pregnant whenever they want because the placenta is going to take care of any remaining circulating testosterone.
So testosterone aromatizes to estrogen. So men also has estrogen, right?
Absolutely. So myth one was that testosterone is a male-only hormone. And we now know, of course, it's very important for both men and women. But estrogen is not only a female hormone. Estrogen is also a male and female hormone. So yes, when men break down their testosterone, it does aromatize it to a certain amount into estrogen. So if we draw an estrogen level on a man at any given time, we're going to have an estrogen level in them. Now, it's just not as high as in women. They're different levels, but both men and women contain both testosterone and estrogen.
So that's another topic for next time.
That's right. We'll have to do a separate podcast on estrogen in men.
So how do we know we're not overdosing women when it comes to the testosterone? Because currently there's no guideline in terms of the optimal range for women, correct?
There's no nationally approved guideline on what women's testosterone level should be as we age. But what we can do is look at some abnormal states and see what that does to women. So there is sometimes a condition where a woman will have a testosterone producing tumor. Typically that grows on the ovary or the adrenal gland. And this is a tumor that's just pumping huge levels of testosterone out into the woman's system. Usually when that happens, her testosterone levels are 400 to 1,000. For a woman, those are very, very high levels. Some of the symptoms she might have when her testosterone level is up that high are symptoms of virilization. Her voice may get deeper. She may actually lose some breast tissue. Her clitoris may enlarge. She may start having male pattern baldness, like losing hair at her temples. So she starts physiologically turning into looking like a male. And in fact, as gynecologists, when we see those changes, we're on the hunt for a testosterone producing tumor because we know that those exceedingly high levels can only be produced by a tumor. When we are optimizing women's testosterone levels, we're not getting anywhere near those tumor levels of 400 to 1,000. We're usually raising them somewhere to between 150 to 250, sometimes maybe up to 300, but we're at a much lower level where patients are feeling great, but not having any of those virilization side effects. So even though there are no national guidelines on where to raise a woman's testosterone to, I think we can use those tumor levels to help us know what is too much and make sure we're not overdosing that testosterone level.
And some women likes to be in between the 100s to the 150s, just because when they go higher than that, they're not seeing any more benefits, but also getting side effects like hair growth and acne.
Right. And I think when those women say, oh, I'm very sensitive to testosterone, what they really mean is their receptors are extremely sensitive to testosterone. So as we age, the testosterone receptor breaks down. It doesn't respond as well. And what that usually means is we have to use higher doses of testosterone to get the same effect because the receptor isn't transmitting the signal as well. But if your receptors are working wonderfully, then you can use lower doses of testosterone to produce that same effect. So I don't think the absolute level of testosterone is as critical as how do you feel? Because as it stands now, we don't have a way to measure how sensitive your androgen receptors are. We just kind of have to do it by let's give you some testosterone and see what your clinical response is. So if you feel great when your testosterone level is up at 110, that's your level. That's your receptors are maximized there. Other patients are not going to have that same clinical result unless their testosterone level is maybe up to 220 or 250 or something like that. So it's a very individualized process.
Yes, and that's why it's important to have a provider that will listen to your side effects and listen to your concerns and things that you want to improve, because we do individualize the amount of testosterone each patient can get. We have an algorithm that we use to help decide what dose we should start with, but it's so important to also do the follow-ups, because that's when we will know if we need to adjust our dosing based on side effects or lack of symptom improvement.
Right. That algorithm is only the starting point. So it just gives us a place to aim for, and then we adjust up or down as necessary. And I really think the missing piece of information there is the sensitivity of the receptor. If we could know that, we could zero in on their dose much better. But it usually takes both men and women a couple of rounds of therapy to get our patient into a happy range where their levels are not too high, but they also are having all the symptom relief that they want. So I think we did a great job today attacking some of the top myths about testosterone and starting to get into all of the myriad of benefits of testosterone. It's one area where there is so much misinformation about therapy. And I really feel like there's just a generation of aging women who could so much benefit from proper testosterone optimization. Thanks so much for listening to today's episode. No information from this recording is intended as a diagnosis or treatment for any disease. If you are enjoying the show, please subscribe so you don't miss any of our exciting episodes. And we love to hear from our listeners and would be grateful for your positive review. We'll talk next time.